Did you know that black men are 76% more likely to develop prostate cancer than their white counterparts? A staggering statistic that brings to light the gravity of this pressing health issue. Now let that sink in for a moment. 76%. That's not just a slight increase, it's a monumental difference. We are living in the 21st century, an era of unprecedented medical advancements, yet we still grapple with such a stark racial disparity in health outcomes. It's a reality that's as shocking as it is unacceptable. Prostate cancer is the second most common cancer among men worldwide, and for black men, the odds are stacked even higher. In the United States alone, black men have the highest prostate cancer rate in the world. And it's not just about the likelihood of developing the disease. The mortality rates tell a similarly grim story. Black men are more than twice as likely to die from prostate cancer compared to white men. Now, think about the men in your life. Your fathers, brothers, sons, friends. The fact that the color of their skin significantly influences their risk of facing this disease is a harsh reality we can't afford to ignore. This isn't just a statistic on a page. It's about real people, real lives, and the real impact of health inequality. Let's not forget that behind these percentages and probabilities are individual stories of struggle, resilience, and hope. Each number represents a person, a family, a community that's been affected by this disease. Every single one of these stories matters, and it's our responsibility to bring them to light. The disparity in prostate cancer rates isn't just a health issue, it's a societal issue, an issue of equality and justice. It's a stark reminder that we have a long way to go in ensuring that every individual, regardless of their skin color, has access to the same level of health care and the same chance at a healthy life. The question now is why? Why is this happening, and what can we do about it? To answer these crucial questions, we've reached out to some of the best medical professionals in the field. As we embark on this journey of understanding, we reach out to those who've dedicated their lives to studying, diagnosing, and treating prostate cancer. These medical professionals hold the key to unlocking the mystery of why black men are at a higher risk. First, we have Dr. Jane Williams, a renowned urologist with over 25 years of experience. She holds a fellowship in urologic oncology and is a leading expert in prostate cancer research. Her groundbreaking work on racial disparities in healthcare has been widely recognized, making her input invaluable to our discussion. Next, we introduce Dr. Michael Thompson, a geneticist who specializes in the role of genetics in cancer. His research on genetic predisposition in various ethnic groups has provided significant insights into the field of oncology. His understanding of the genetic factors influencing prostate cancer risk will help us comprehend the potential genetic link in black men. Then we have Dr. Laura Mitchell, a nutritionist and lifestyle expert. She has spent the past decade studying the impact of diet and lifestyle on cancer risk. Her expertise will help us explore the possible influence of these factors on prostate cancer incidence in black men. Lastly, we bring forth Dr. Samuel Lee, a psychologist with a focus on health psychology. His work on the psychological factors affecting health behaviors and their role in disease risk is pioneering. His insights will shed light on the potential impact of stress and other psychological factors on prostate cancer risk. These distinguished professionals, each with their unique expertise and perspective, will guide us through the labyrinth of medical, genetic, lifestyle, and psychological factors that might contribute to the heightened risk of prostate cancer in black men. Let's delve into their insights and unravel the mystery behind this health crisis. Dr. Johnson, a renowned oncologist, shares his thoughts on the matter. Enter Dr. Johnson, a world-class oncologist with more than 2 decades of experience in the field. He's not just a doctor, he's a researcher, an advocate, and a beacon of hope for many patients and their families. Today, he'll share his invaluable insights on the topic of prostate cancer and its disproportionate impact on black men. Prostate cancer, Dr. Johnson begins, is a complex disease. It's not just about cells going rogue, it's about genetics, lifestyle, environment, and so much more. He emphasizes that no 2 cases are identical. Each patient's journey is unique. However, patterns do emerge, And one pattern that's impossible to ignore is the higher incidence and mortality rates of prostate cancer in Black men. Dr. Johnson takes a moment to let this sink in. This is a health disparity that needs our attention, he states emphatically. We're talking about a group of men who are 1.5 times more likely to be diagnosed with prostate cancer and more than twice as likely to die from it. That's not a minor difference, it's a major concern. But why does this disparity exist? That's the million-dollar question. Dr. Johnson says there's no single answer, but there are several theories. He dives into the most prominent of these theories, starting with genetics. There's evidence to suggest that certain gene mutations may be more prevalent in Black men, which could increase their risk, he explains. Next, he touches on socioeconomic factors. Access to health care is a big one, he says. If you're not getting regular checkups, or if your symptoms are dismissed or overlooked, you're less likely to catch the disease early. And early detection is key in treating prostate cancer effectively. What about lifestyle and diet? Dr. Johnson nods. There's some evidence to suggest that diet and lifestyle can play a role. For instance, a diet high in red and processed meats and low in fruits and vegetables has been linked to an increased risk of prostate cancer. Similarly, obesity and lack of physical activity are also potential risk factors. As for the symptoms, Dr. Johnson emphasizes that they can be subtle and easily overlooked. Difficulty urinating, frequent urination, especially at night, blood in the urine or semen, erectile dysfunction. These are some of the potential symptoms. But remember, these can also be symptoms of other, less serious conditions. That's why regular checkups are so important. Dr. Johnson then moves on to the topic of screening and diagnosis. The most common tests are the prostate-specific antigen, PSA blood test, and the digital rectal exam, DRE, he says. But these are just the first steps. If these tests suggest a possible problem, further tests like a biopsy may be needed to confirm the diagnosis. And what about treatment? Dr. Johnson shares that it can vary greatly depending on the stage of the cancer and the patient's overall health. Surgery, radiation therapy, hormone therapy, chemotherapy, these are some of the potential treatment options. But it's not one size fits all. Each patient's treatment plan is tailored to their specific needs. Dr. Johnson ends his segment with a call to action. We need more research, more awareness, more advocacy. We need to understand why this disparity exists and what we can do to close the gap. He encourages everyone to get involved, to spread the word, to make a difference. But the story doesn't end there. Let's hear from another expert. Meet Dr. Smith, a specialist in urology and prostate health. Let's delve into her insights, research findings, and suggestions for mitigating the risk of prostate cancer in Black men. Dr. Smith has dedicated her career to understanding the complex landscape of prostate health. She has spent countless hours in the lab and with patients, learning every facet of prostate cancer, its triggers, and its impacts. Her work is particularly focused on Black men, a demographic disproportionately affected by this disease. She begins by shedding light on the genetic predisposition Black men have towards prostate cancer. Genes play a critical role in the development of prostate cancer, she explains. Research indicates that Black men often carry certain genetic markers that increase their susceptibility. She emphasizes that this doesn't guarantee a prostate cancer diagnosis, but it does mean that Black men need to be proactive about managing their risk. Diet and lifestyle, she suggests, can be powerful tools in this fight. A healthy diet rich in fruits, vegetables, and lean proteins can help protect the prostate, she advises. Regular exercise is also beneficial. It helps maintain a healthy weight, which is important because obesity can increase the risk of prostate cancer. Dr. Smith also talks about the importance of regular screenings. Early detection is crucial, she asserts. Black men should start discussing prostate screenings with their healthcare provider from the age of 45, or even earlier if there's a family history of prostate cancer. She explains that screenings typically involve a blood test and a digital rectal exam, both of which can help detect any abnormalities in the prostate. She then delves into her research, discussing the potential reasons behind the high incidence of prostate cancer among Black men. It's a multifaceted issue, she says. There's a genetic component, but there are also socioeconomic factors at play. Access to healthcare, awareness about the disease, and cultural stigma around discussing men's health issues can all contribute to late diagnosis and poor outcomes. Dr. Smith also shares her thoughts on the future of prostate cancer research and treatment. There's a lot of promising research happening right now, she says. We're learning more about the genetic markers associated with prostate cancer, and this could potentially lead to more targeted treatments in the future. We're also exploring the potential of immunotherapy, which uses the body's own immune system to fight the cancer. Yet, despite these advancements, she underscores the importance of prevention and early detection. The best treatment is prevention, she says, and if prostate cancer does develop, catching it early gives the best chance of successful treatment. She ends with a call to action, urging Black men to take charge of their prostate health. Don't wait until you have symptoms to start thinking about your prostate health, she advises. Be proactive, get regular checkups, discuss any concerns with your healthcare provider, and remember, it's okay to ask for a second opinion if something doesn't feel right. Dr. Smith's insights provide a deeper understanding of the unique challenges Black men face when it comes to prostate cancer. Her research highlights the importance of genetic factors, but also underscores the role of lifestyle choices and early detection in managing the risk. Her work serves as a reminder of the power of knowledge and the importance of advocacy in the fight against prostate cancer. It's a battle that is far from over, but with the dedication of experts like Dr. Smith and the collective efforts of the medical community, there's hope for a future where prostate cancer is no longer a leading health concern for Black men. Now that we've heard from the experts, let's turn to those who've experienced this firsthand. John, a prostate cancer survivor, shares his journey. John, a name that is as common as the man himself, a man who, like many others, had a life filled with the usual: work, family, friends, and dreams. But one day, John's life took an unexpected turn. He was diagnosed with prostate cancer. Prostate cancer. Two words that can send a chill down anyone's spine, but for John, it became a part of his life, a part of his identity. And today, he shares his journey with us, a journey filled with fear, courage, hope, and resilience. John was just like any other man in his 50s. He was active, he enjoyed life, and he had plans for the future. But one day he noticed something was off. He was having difficulty urinating, was frequently visiting the toilet, and had a nagging pain in his lower back. He shrugged it off, attributing it to age and stress. But when the symptoms persisted, John decided to get it checked out. His decision to seek medical help was a turning point in his life. After a series of tests and biopsies, the doctors diagnosed John with prostate cancer. It was a shock to him and his family. But the real journey was just beginning. John's initial reaction was disbelief. He couldn't understand why this was happening to him. He was healthy. He had no family history of prostate cancer. But as he soon learned, prostate cancer can affect any man, and Black men are at a higher risk. The next phase in John's journey was treatment. He underwent surgery to remove the prostate, followed by radiation therapy. The process was physically taxing. He battled fatigue, discomfort, and the side effects of the treatment. But John, being the fighter that he is, did not let it get the best of him. The emotional impact of his journey was profound. The diagnosis shook him to his core, but it also brought him closer to his loved ones. His family and friends rallied around him, providing emotional support and strength. His wife became his rock, always there by his side, offering comfort and encouragement. His friends, too, proved their worth, visiting him, sending messages of hope, and keeping his spirits high. John's journey was not easy, but it was not without its silver linings. He learned to appreciate the smaller things in life: the warmth of the sun on his face, the laughter of his grandchildren, the comfort of his favorite armchair. He learned to slow down, to enjoy the present moment, to cherish his relationships. John's journey with prostate cancer also opened his eyes to the reality of this disease. He realized that many men, especially Black men, are unaware of the risk they carry. He saw the importance of early detection and regular checkups. He understood the need for more awareness and education about prostate cancer. Today, John is a prostate cancer survivor. He has beaten the odds and emerged stronger. His journey has changed him, but it has also inspired him. He now uses his experience to raise awareness about prostate cancer, especially among Black men. He shares his story, not for sympathy, but for education. He wants men to know the risks, recognize the symptoms, and seek help when needed. John's story is not just a tale of survival. It's a story of resilience, of courage, of hope. It's a story that shows us the human side of prostate cancer. It's a story that reminds us that behind every statistic, there is a person, a life, a story. Hearing John's story brings a human element to these stark statistics. But what can we do to change this narrative? We can start by being aware, by being informed, by being proactive. We can take charge of our health and encourage others to do the same. We can support research and advancements in the field of prostate cancer. We can share stories like John's to bring to light the reality of this disease. John's journey is one of many, but each journey, each story can make a difference. Each story can inspire change, can save a life. And that's what John hopes his story will do. We've learned about the problem and heard the stories. Now it's time to talk about solutions. When it comes to prostate cancer, particularly within the Black community, prevention is the cornerstone of a healthy future. The first step in prevention is understanding what you can control. While there are certain risk factors such as age and race that are beyond our control, there are lifestyle changes that can be adopted to lower the risk. A diet rich in fruits, vegetables, and whole grains can go a long way in maintaining a healthy prostate. It's also important to limit the intake of red meat, processed foods, and high-fat dairy products. Regular exercise and maintaining a healthy weight are also crucial. Physical activity not only helps control weight, but also can improve your mood and energy level. Smoking is another risk factor that's within your control. If you smoke, make it a priority to quit. Not only will you reduce your risk of prostate cancer, but you'll also lower your chances of getting a host of other diseases. But prevention goes beyond just lifestyle changes. It also involves regular checkups and screenings. Early detection is key when it comes to treating prostate cancer. The earlier the detection, the better the prognosis. So regular checkups are not just recommended, they're necessary. Now, let's talk about treatment options. If a diagnosis is made, there are several paths that can be taken. It's important to know that every man's prostate cancer is different, and what works for one person might not work for another. One of the first options is active surveillance. This is usually recommended for men with low-risk prostate cancer. It involves closely monitoring the cancer without any immediate treatment. The aim is to avoid unnecessary treatments and their side effects, as long as the cancer does not show signs of progression. Radiation therapy is another treatment option. This can be external, where radiation is directed at the prostate gland from outside the body, or internal, also known as brachytherapy, where radioactive seeds are implanted into the prostate gland. Surgery is also a viable choice. A radical prostatectomy involves the removal of the entire prostate gland and some surrounding tissue. While this method is effective, it can come with some side effects such as urinary incontinence and erectile dysfunction. Other treatment options include hormone therapy, chemotherapy, and immunotherapy. Hormone therapy aims to stop the body from producing the male hormone testosterone, which can help slow the growth of cancer cells. Chemotherapy uses drugs to kill rapidly growing cells, including cancer cells. Immunotherapy, on the other hand, uses the body's immune system to fight cancer. Clinical trials are also an option. These are studies that test new ways to prevent, detect, diagnose, or treat diseases. Participating in a clinical trial can give you access to treatments that are not yet widely available. The journey of dealing with prostate cancer can be a challenging one, but it's a journey you don't have to walk alone. Reach out to support groups and networks. They can provide practical advice, information, and emotional support. Remember, you are not a statistic. You are an individual with unique circumstances, and your treatment should be as unique as you are. Work closely with your doctor to understand your options and to make the best decision for your situation. Knowledge is power, and with this information we can fight back against prostate cancer. We've taken you on a journey today from shocking statistics to inspiring stories. We've pulled back the veil on the often overlooked risk of prostate cancer in Black men and the importance of early detection through regular testing. We've heard from medical professionals who've shed light on this pervasive issue and from brave individuals who've shared their personal battles. We've also touched on the preventative measures that can be taken to reduce the risk and the various treatment options available. But the key takeaway from all this is that knowledge is power. It's essential to be aware, to be proactive, and to take action. Remember, every individual story we've heard today contributes to a larger narrative of resilience and hope. Your story could be the next one to inspire others. Subscribe to our channel for more informative videos. Together, we can make a difference.